Bonjour. Let's talk about the knee joint. Got a knee joint model right here. I got a femur up top. There's the femur. Got a tibia down here, big shin bone tibia. And I got a fibula right here. Fibula is always going to be lateral, so this must be my right knee. Tibia is always medial. Fibula is always lateral. Okay, so we're interested in this knee joint, which is going to be the joint between the femur and the tibia. Plus, we got to be aware of the joint between the patella and the femur. Okay? We got to name all these tendons and cartilages and associated things. So I got my femur right here. My femur is going to articulate with my patella. There's a smooth patellar surface right there, which is going to let the patella kind of slide on the femur. Superiorly to the patella, I have a tendon called the Quadriceps Tendon. So it goes to a big group of anterior thigh muscles here called the quadriceps. Inferior to my patella, kind of continuous with that Quadriceps tendon, is a patellar ligament, which is going to be anchored onto a bump on the front of the tibia, which is called the tibial tuberosity. So that is one thing to consider. We also must consider the joint between the femur and the tibia. I've got my femoral condyles here, and I've got my tibial condyles here. At their articulation, we can see that in the back maybe even better. At their articulation, I have a pair of lateral and medial pads of fibrocartilage. These pads of fibrocartilage, because they're kind of curvy, if you look inside there, you can see they're kind of curvy. Because of their curviness, they are known as menisci. Each is a meniscus. So I'll have a lateral and a medial meniscus. And that is because we're supporting so much weight here. We need a nice, strong pad of fibrocartilage. Now, on the lateral side of my knee joint, I have a lateral collateral ligament. Collateral because it's alongside. Lateral in order to contrast it with the medial collateral ligament here. So these two ligaments are going to give the knee joint extra support, laterally and medially, respectively. But they're not the only ligaments we got to be aware of. If I look back here, okay, this guy right here is my posterior cruciate ligament. If I open him up in the front, I can see my anterior cruciate ligament. And these guys are going to give us more support. They're basically going to set that femur on top of that tibia and prevent any anterior or posterior displacement from happening. All right, I think that's it for this one. Another video done. See you later.